Diagnosis of brain, spinal cord, and nerve disorders. A neurologic examination can detect disorders of the brain, spinal cord, and nerves. This examination can also help detect muscle disorders because muscle contraction depends on stimulation by a nerve. The two main components of a neurologic examination are the medical history and the physical examination, including mental status evaluation. If necessary, diagnostic procedures are performed in order to confirm the diagnosis or exclude other possible disorders. A neurologic examination differs from a psychiatric exam, which focuses on a person's behavior. However, the two examinations overlap somewhat because abnormal behavior often provides clues about the brain's physical condition. Concerning medical history, before performing a physical examination, doctors interview the person. Doctors ask the person to describe current symptoms, telling precisely where and how often they occur, how severe they are, how long they last, and whether daily activities can still be performed. Again, we're talking about duration, how long they occur, how severe they are, and at the intensity. So we're talking about duration and intensity here. Many different symptoms can be caused by neurologic disorders, but such symptoms can be caused by other disorders. The person is also asked about past or present illnesses and past operations as well, serious illnesses in close blood relatives, allergies, and drugs currently being taken. In addition, doctors may ask if the person has had work-related or home-related difficulties, such as loss of a loved one, because such circumstances may affect the person's health and their ability to cope with illness. A physical examination. When a neurologic disorder is suspected, doctors usually evaluate all of the body systems during the physical exam, but focus on the nervous system. The neurologic aspect includes evaluation of mental status, cranial nerves, motor and sensory nerves, reflexes, coordination, stance, gait, regulation of internal body processes by the autonomic nervous system, ANS, and blood flow to the brain. There is mental status, cranial nerves, and motor and sensory nerves in the physical examination. Concerning mental status, doctors evaluate the person's attention, orientation to time, place, and person, memory, and of course various abilities such as thinking abstractly, following commands, using language, and solving math problems. Of course, the evaluation consists of a series of questions and answers, as well as tasks such as naming objects, recalling short lists, writing sentences, and copying shapes. So the person's answers are recorded and scored for accuracy. Mood is also evaluated as well, and if the person reports feeling depressed, doctors ask if there have been any thoughts of suicide or any suicidal behavior. Cranial nerves. Doctors test the function of the 12 cranial nerves, which are connected directly to the brain. How many nerves are tested depends on what type of disorder is suspected. For example, cranial nerve 1, the nerve of smell, is not usually tested when a muscle disorder is suspected, but it is tested when a head injury has occurred. A cranial nerve may be damaged anywhere along its length as a result of an injury, a tumor, or an infection, and the exact site of the damage must be identified. Motor and sensory nerves. Motor nerves carry impulses from the brain to the voluntary muscles, or the muscles controlled by conscious effort, such as the leg muscles. Weakness or paralysis of a muscle may indicate damage to a motor nerve. Doctors look for muscle wasting or atrophy, which results when a muscle nerve is not stimulating the muscle, and then test for weakness in various muscles by asking the person to push or to pull against resistance. And so sensory nerves carry information to the brain without such things as touch, pain, heat, cold, vibration, the position of body parts, and the shape of objects. Abnormal sensations or reduced perception of sensations may indicate damage to a sensory nerve. Doctors may then be able to pinpoint the specific location or level of damage to the spinal cord by evaluating sensory nerves. Sensory nerves carry information from specific areas on the body's surface, and these are called dermatomes. To a specific level of the spinal cord, of course, there is loss of sensation in areas on the body's surface applied by a specific level of the spinal cord, and the levels below it indicates damage to that level of the spinal cord. The surface of the body is tested for loss of sensation. Usually doctors concentrate on the area where the person feels numbness, tingling, or pain, A pin is used first, then a blunt object, such as the head of a safety pin, in order to see if the person can tell the difference between sharp and dull sensations. The person's ability to detect a gentle touch, heat, and vibration may also be tested. To test position sense, doctors tell the person to close their eyes. Then they move the person's finger or toe up or down and ask the person to describe its position. Concerning the reflexes, a reflex is an automatic response to a stimulus. So it's SR and would go with SR psychology. For example, the lower leg jerks when the tendon below the kneecap is gently tapped with a small rubber hammer. Of course, the pathway that a reflex follows is called the reflex arc, and it is a complete circuit without involvement of the brain at all. Doctors test reflexes in order to determine whether the sensory nerve to the spinal cord, the nerve connections in the spinal cord, and the motor nerves back to the muscle are all functioning correctly. Of course, the reflexes most commonly tested are the knee jerk and similar reflexes at the elbow and the ankle. A test for Babinski's sign is performed by firmly stroking the outer border of the sole of the foot with a key or any other object that causes minor discomfort. So normally the toes curl downward except the infants in age 6 months or younger, having the big toe go upward and the other toe spread out as a sign of an abnormality in the brain or the spinal cord. Concerning coordination, stance, and gait, to test coordination, doctors ask a person first to use the forefinger to reach out and touch their finger when the person's own nose, and then to repeat these actions rapidly. The person may be asked to perform these actions first with the eyes open, then with the eyes closed. For the Romberg test, the person may be asked to stand still with both feet together and the eyes closed. Then the person may be asked to walk in a straight line, placing one foot in front of the other. These actions test the motor and sensory nerves as well as the brain function. Other simple tests may also be performed. Automatic nervous system, or ANS as we have said, the automatic or involuntary nervous system regulates internal body processes that require no conscious effort. An abnormality of this system may cause such problems as a fall in blood pressure, or BP, when a person stands, with his orthostatic hypotension, reduction or absence of sweating, or sexual problems such as difficulty initiating or maintaining an erection. Doctors may perform a variety of tests such as measuring blood pressure while the person is sitting and after the person stands. Blood flow to the brain. A severe narrowing of the arteries that carry blood to the brain reduces blood flow and puts a person at risk of stroke. The risk is higher for people who are older or have high blood pressure or high BP, diabetes 1 or 2, and disorders of the arteries or the heart. And so that would be in cardiology, the study of the cardiovascular system. And in order to evaluate the arteries, doctors place a stethoscope on the neck and listen for characteristic sounds caused by turbulent blood flow through a narrowed area called Brutus. However, procedures such as color Doppler ultrasonography, magnetic resonance angiography, or cerebral angiography are needed for an accurate evaluation of narrowed arteries. Diagnostic procedures. Diagnostic procedures may be needed to confirm a diagnosis suggested by the medical history and physical examination. Before going on to diagnostic procedures, we'll talk about the reflex arc. The reflex arc is the pathway that a nerve reflex, such as the knee-jerk reflex, follows. First would be a tap on the knee, which stimulates sensory receptors, generating a nerve signal. The signal travels along the nerve pathway to the spinal cord, and then at the spinal cord, the signal is transmitted from the sensory nerve to a motor nerve. The motor nerve then sends the signal back to a muscle in the thigh, and the muscle contracts, causing the lower leg to jerk upward. The entire reflex occurs without involving the brain. We have 3 steps: the hammer, then we have the signal traveling up to the spinal cord. 3, the spinal cord. At the spinal cord, the signal is transmitted from the sensory nerve to a motor nerve, and then it travels back down through the leg muscle in the thigh, and then the muscle contracts, causing the lower leg to jerk upward. The entire reflex occurs without involving the brain. Talking a little bit about mental status testing. what people may be asked to do, and what this test indicates. We could, for example, state the current date and place and ask them to name specific people. This will orientation to time, place, and person. We could ask them to repeat a short list of objects. That will indicate their attention. To recall the short list of objects after 3 to 5 minutes, and that would be to test immediate recall. If we ask them to describe an event that happened in the last day or two, that would test recent memory. If we would ask them to describe events from the distant past, that will test their remote memory. We could ask them to interpret a proverb, such as rolling a stone gathers no moss, or to explain a particular analogy, such as why the brain is like a computer. That would test abstract thinking. We could ask them to describe feelings and opinions about the illness. That would test for insight into their illness. To name the last 5 presidents in the state capitol, to test their fund of knowledge. To ask them how they feel on this day and how they usually feel would test their mood. To ask them to follow a simple command that involves 3 different body parts and requires distinguishing right from left, such as put your right thumb over your left ear and stick out your tongue. That would test the ability to follow simple commands or directions. To test the ability to use language, we may have the patient name simple objects and body parts. We may ask them to read, write, and repeat certain phrases. To test their ability of the brain and their ability of their brain to process information from sense organs, we may ask them to identify small objects held in the hand and numbers written on the palm. To discriminate between being touched in 1 or 2 places, for example on the palm and on the fingers. We could ask them to copy simple and complex structures, for example using building blocks or finger positions, to draw a clock, a cube, or a house, and that would test the ability to understand spatial relationships. We could ask them to brush the teeth or take a match out of a box and strike it to test their ability to perform an action. Or to test their ability to solve mathematical problems, we may ask them to perform simple arithmetic. Concerning what is a neurologic symptom, neurologic symptoms caused by a disorder that affects part or all of the nervous system, can be almost anything because the nervous system controls all bodily functions. However, many symptoms that can be neurologic, such as headache, are usually caused by other disorders, and so neurologic disorders commonly cause pain. Muscles may malfunction because a nerve is damaged or compressed. Changes or mutilation in sensation, including vision, may occur. Neurologic disorders can interfere with sleep or affect the level of content of consciousness. Neurologic symptoms may indicate a relatively minor disorder, such as a foot that has fallen asleep, for example, or a simple disorder that can be corrected or controlled with treatment, such as a herniated disc or diabetes, or a serious life-threatening disorder, such as a brain tumor. Often, however, the characteristics and pattern of symptoms help doctors to diagnose or to exclude a neurologic disorder. The following are some relatively common neurologic symptoms. Certain pain could be back pain, neck pain, headaches, or pain along a nerve pathway. And we might have muscle malfunction, weakness, tremor, paralysis, and voluntary movements such as tics, abnormalities in walking, clumsiness, or poor coordination skills, muscle spasms, rigidity, or slowed movements. Changes in sensation would be blurred vision, partial or complete loss of vision, or deafness, tingling sensations, vertigo, double vision, misinterpretation of visual images, loss of sensation for touch, cold, heat, or pain, or a loss in position sense. Concerning sleep problems, they would have difficulty falling or staying asleep, uncontrollable leg movements, sleeping too much, such as narcolepsy. Changes in consciousness would include dizziness, fainting, dissociation, confusion or delirium, dementia, seizures, coma, stupor, or persistent vegetative state. Next, we're going to talk about diagnostic procedures.